Hi, everybody. My name is Lucian Wilson with Insure the Uninsured Project. We are going to begin the second half of the ObamaCare 101 trainings on health reform. In this session, we are going to be talking about insurance reforms, individual mandates, covered California, premium tax credits, a variety of other things. With me today are Carolina Coleman from the ITUP staff and Kiwan Yu from the ITUP staff, so we'll be splitting this up amongst all of us. We really want to thank so very, very much our friends at LA Care, California Community Foundation, and the Community Clinic Association of Los Angeles County, who've done all the work to make this possible. For those of you who wish to access the materials that ITUP's prepared, you can find them on the ITUP website and just click on ObamaCare 101 and you'll have access to all the materials. So I'm assuming that you all are paying rapt attention and ready for us to go into the training. So in the last week's session, we talked about Medi-Cal. In this session, we're going to be talking about commercial insurance, private insurance. As you all recall, people may have private insurance in one of two ways. The first is individually, and the second is through an employer. And there's some differences that we'll be talking about in terms of the rules for small employers and large employers, and then we'll be weaving together the individual market reforms with the covered California and what that's going to be doing. So we're going to start off with the insurance market reforms, and it's important for everybody to know that these insurance market reforms apply to small employer plans, and they apply to individual plans. Many of these reforms were in place and have been since about 1993 for California small businesses, and many of these changes in California are going to be important in terms of changing what happens in the individual insurance market. So the first rule you need to be familiar with is way back when there used to be what are called rescissions, in which a health plan would say, essentially, we don't think we should have sold you the coverage because we didn't know that you were sick, or something to that effect, and they would rescind your coverage. That practice ended pretty much effectively on the September 23rd, 2010. Some other important features that you've probably heard about is the opportunity for people who are children up to the age of 26 or young adults up to the age of 26 to be able to access coverage through their parents' plans. Another important feature was the inability of plans to impose lifetime limits on coverage. That is going to be expanded, so it's annual limits. And another important feature was the ability to access preventive services without cost sharing. Now, the key things that you need to be aware of are the features of guaranteed issue, which is that all plans have to be sold to everyone who seeks to purchase them, and there will be no more pre-existing conditions. So those take effect on January 1st, 2014. For those who were children, those were already in effect. But these are very important. These have been in effect for small employers since 1993. They've been in effect for children since 2010. Now they will apply to adults. There are some other rules that are also important that also apply in California, and California and other states has some ability to change the federal reforms, and so I'm going to describe to you what the rules are in California. So in California, and all over the country. The new rules are that age rating still stays in place, but within a rate band of 3 to 1. What that means is that somebody who's 21-year-old and their parent or grandparent who happens to be 64-year-olds, the grandparent would pay no more than 3 times as much as the 21-year-old. Next feature is geography. The federal rules said there were going to be about 6 different geographic variations. California said, we actually think there are 19 within our state, and it appears that the federal government is approving California operating with 19 different geographic regions. These are mostly by county, but in Los Angeles County we're fortunate enough to be split in half so that you will find it as geography 15 and 16 in the insurance plans. Family size, obviously the more people you cover, the more expensive the plan. So basically for ongoing and into the future, the 3 features are age, geography, and family size. Federal law would have allowed tobacco use as well. California decided that was not a good way to go. So every plan that is sold in the individual market and small employer market going forward has to meet the standard of being a qualified health plan. And that means that the 10 essential health benefits have to be covered. California decided that it wanted to link these to the Kaiser Small Group 30 Plan HMO. And so you can see that doctor's visits and hospitalization services, maternity benefits, prescription drugs, behavioral health services, lab services, and importantly pediatric care such as oral and vision care. All of those are covered services. Now you probably might be asking, well, I had a plan before which didn't have all of these services. So assuming you had a plan before that didn't have all these services and you wanted to keep that plan, that's called a grandfathered plan. And a grandfathered plan operates under the rules prior to the ACA, but future coverage must comply with the Affordable Care Act. So the essential rules are, if you have a grandfathered plan and you like it, you can keep it. If you want to upgrade to the coverage that's available through qualified health plans under the Affordable Care Act, then you can access it here. So now I'm going to go on and talk to you about the probably one feature that you most have heard about under the Affordable Care Act, and that is the requirement that all individuals have coverage. I frankly can't imagine getting seriously ill or injured or in an accident and having to pay for every part of that out of pocket. And the Affordable Care Act essentially says pretty much any health care coverage that you have is satisfactory. And so people who don't have any health care coverage at all are encouraged, as we'll talk about, to enroll in some coverage. But if you have coverage through your employer or your union, that's fine. If you have individual coverage, that's fine. If you have VA coverage or Indian Health Services, that's fine. And if you have Medicare or Medi-Cal coverage, that's fine as well. So important to know that people with Indian Health Services or Veterans Administration coverage who want to come in and join the exchange and get coverage through the exchange, they can all do that. Many of the other features like employer or union coverage, Medi-Cal coverage, Medicare coverage, you would not be able to drop that and move into covered California or the exchange plans. So this is an important feature, and I'm just going to talk to you about the fact that there are some people who don't want to have health insurance, and there's some people who can't afford health care coverage. So for those who can't afford health care coverage, the general rule is if the lowest cost bronze plan would exceed 8% of the household income, you are exempt. Doesn't mean you can't buy coverage. It means you can buy coverage, but you would not be subject to any penalties if you did not buy coverage. Also, people who are below the tax filing threshold, which you can see here is $10,000 for an individual, they don't have to buy coverage. Most of them would be Medi-Cal eligible under any circumstance and should enroll in coverage. These are just some rules that everybody needs to be aware of. There are some religions that really do not believe in health care and have religious objection to it, so that's an exemption. The undocumented do not get help under the Affordable Care Act, so those folks are not required to enroll. People who are in jail have access to jail health, and they certainly are not required to enroll. Now, what happens if you are an individual and you say, I don't fall into any of these other exemptions, and I still don't want coverage, even if it may be somewhat affordable? You would have to pay a penalty in the future, and that penalty is, as you can see here, $95 or 1% of your income, whichever is more. And that begins in 2014, so this will begin to show up in your 2015 tax filings and tax forms. Those figures go up, so they go up to $325 and then to $625, and from 1% to 2% to 2.5%. They set it $695 or 2.5% in 2016 and thereafter, but it's important to know that this is for an individual, so if it's a husband and wife, it could be twice as much, and children add on a little bit more, but that's at half the rate of the adult rate. So these are important for people to understand. 1% of your income, if you're only making $10,000, is not that much, but if you're making $100,000, it can be somewhat steeper. So individuals need to know that. But I think the most important reason why people are going to want to enroll in coverage is simply that they are facing very significant out-of-pocket expenses when something happens to them. I can tell you that a number of years ago I was peacefully riding my bike and a car hit me, and I ended up with a broken hip, and eventually I was taken to the emergency room and they did an operation, and I was very surprised to see the bill from the doctor and the hospital and the amount of the bill, and I said that would basically wipe me out. I did have health insurance. I did apply to have it covered, and that reduced the bill by a factor of 5. So it's all going to depend upon the particular hospital, the particular type of coverage you have, but it is incredibly important if you have things like some savings for your kids to go to college, or for your retirement, or for the down payment on the house, or getting a car, or whatever, that you at least consider that as you make the decisions as to whether or not you wish to have health insurance. So some of you probably have heard that small employers are required to offer health insurance. That's not accurate. Rule is for small employers are not required to offer health insurance, but they can if they wish to, and they can get some financial help in doing so. So the financial help is in the form of a tax credit, which can pay up to 50% of the premium. Those are graduated based on size of the employer and the wages of the employer. So below 25,000 and below 10 employees, you get the maximum, and then it phases out as you get up to 25 employees and 50,000 in average wages. This can pay up to 50% of the premium cost, and it's a very important feature for small employers to be aware of, and it's only available through the exchange through Covered California. So important for some small employers who may wish to avail themselves of this tax credit to do so through Covered California, and these tax credits are only going to be good for about 2 years. Now, some of you have heard that there is a requirement that large employers are also required to offer health insurance, and that is accurate. So large employers with 50 or more full-time equivalent employees have to offer health insurance, or they have to pay a fee or a fine or a penalty, or however you wish to refer to it. That particular requirement is delayed till 2015. When you look at this, you say, oh my God, this is big change. It's really not. 94% of all employers over 50 already offer health insurance, and 98% of their full-time, full-year employees already have coverage through them. So just to think about this particular requirement, almost all large employers already offer health insurance, and almost all of them offer insurance that would satisfy these requirements, and 98% of their employees who would be covered by this already have insurance. But what happens for those who do not offer them? And there are, as you just heard, some who do not offer them. They essentially have a choice. They can offer something that's about equivalent to the lowest cost bronze plan, or they can pay a fee. The fee is, if you're not offering at all, $2,000 per employee minus the first 30 employees. So this is a calculation that any larger employer who's not offering coverage would have to make and decide whether they want to pay the fee or whether they wanted to buy insurance for their employees. Now, there are some, and it's somewhat rare, but there are some employers who can also be have to pay a fee if they fail to offer affordable coverage. And affordable for these purposes, just for these purposes, is defined as the employee contribution for the employee-only coverage exceeding 9.5% of family income. Now, these fees only apply if an employee of one of these large employers actually goes into the exchange, or actually goes into Covered California and actually uses the premium tax credits, the premium subsidies, the premium assistance that are available to help people get more affordable coverage. So we've covered the employer requirements, we've covered the insurance company requirements, we've covered the individual requirements. We're going to be open for a few moments if there are questions that I should answer immediately before I turn this over to one of my colleagues. So what are...
So we're taking questions via the chat or questions function. If you have any questions, please type them in. We have 2 questions right now. The first question is, what happens after the first 2 years for small employers offering insurance to employees? If they're paying a portion of insurance, will they be penalized if they stop paying the portion or reduce the amount that they contribute?
So the answer is that the tax credits in the ACA are good for 2 years. There is, as we described, no penalty whatsoever for a small employer who does not offer coverage. So there's no penalty if they choose to offer for 2 years with the subsidies, and then they say after that I can't afford to do so anymore. There is no penalty whatsoever. The next question was, can employers cut the hours to avoid giving their employees insurance? As I understand it, the line, the clear bright line at which you have to offer your employees is essentially 30 hours a week. So there have been fears that some employers may take their employees and reduce them from a 40-hour a week to a 29-hour week. There's been no evidence that that's happened in Massachusetts, been no evidence that that's happening so far that we're aware of, but it is a genuine fear, and let's kind of make sure that we monitor that and see what happens. So next question, is affordable coverage, that coverage is more than 60% of the out-of-pocket cost? So the affordable coverage that we're looking about is something we're going to talk about in a little bit, but essentially it has to be coverage that's equal to what's called the lowest cost bronze plan. Now the bronze plan is a plan that would pay 60% of people's covered medical expenses, and the individual would be responsible for 40%. Now, what does an employer have to do? The employer would have to offer to pay 60% of the premium. So you're talking about 60% times 60%, and you can do the math there. All right. It says here, premium costs are based on age, geography, and family size, but is it also based on income? And the answer is premium costs in the small employer and individual markets are based only on age, geography, and family size. When we get to the Covered California discussion, you will see that the premium assistance that's available is based on income, so individuals will be available based on their income for some help paying some premiums and for some help paying their co-pays and deductibles. Now the next question that I think might be important is just to go back and clarify the rules with respect to legal permanent residence. So the federal rules on legal permanent residence are that in the Covered California, in the exchange, that there is no prohibition. So you can be over 5 years or under 5 years. You can pay your premiums and access coverage through Covered California as a legal permanent residence. So that's important for everybody to keep in mind. We talked earlier about the rules in California as they relate to the Medi-Cal program. California rules are you can be a legal permanent resident and qualify for full scope Medi-Cal. The federal rules are that the state gets reimbursed for the new legal permanent residents at a lower rate for any services that are beyond limited scope services. So that's something that you don't need to know, but for those of you who've been asking the questions about this, just understand there's California rules basically say if you're a legal permanent resident, whether you're here 5 years or less or 5 years or more, you can access both Covered California and the Medi-Cal program. All right. I think we want to make sure that some of these questions get saved till later on, because we'll have a full half hour at the end to do this, and I'm going to turn everything over right now to Carolina, who is going to explain health insurance to you.
Okay, hi everyone. Before I get started talking about Covered California, I wanted to mention that all of our training materials are available on our website, itup.org. Including this slideshow, we also have a lot of great other materials that may be helpful to you as well. I'm going to talk a little bit about Covered California, but before I do, I'm going to just give a little brief glossary, a little look over some frequently asked terms, some frequently used terms when you're talking about private health insurance. Not everybody is familiar with these, so let's make sure we're on the same page. A premium is a monthly amount that you pay for your health insurance. This is a monthly bill, essentially, to be covered. A copay is a fixed amount that you pay when you receive a service. A deductible is the amount that you are responsible for paying before your health insurance kicks in, essentially. Co-insurance is your share of the costs of a healthcare service, 20%, 10%, etc. And then we have two new concepts that are unique to the ACA and unique to the exchanges. We have premium subsidies, also known as premium assistance or tax credits. And this is essentially help from the federal government. It makes your insurance premiums cheaper, and it's only available to people in a specific income range, people between 100% and 400% of the federal poverty level. You also have cost-sharing subsidies, which is more help from the federal government, and this reduces the amount you pay when you get a service, not the monthly costs. This is only available between 100% and 250% of the federal poverty level. Okay, so we're going to talk about Cover California. Cover California is California's state-based exchange or health insurance marketplace, and it is the shiny new toy of the Affordable Care Act. You can check out their website at coveredca.com. They have a lot of really great tools and materials on their website, including a very thorough calculator that you can use to calculate what kind of options you might have. You put in your location and your income and your household size, and you get a very good look at what options you will have and how much it will cost you, including the amount of premium assistance you'll get from the federal government. So Cover California is essentially an online marketplace. It is a website in which you can go on and see what kind of health insurance options you may have and how much they would cost, and if there are any assistance options available to you from the federal government. Cover California is an independent organization. It's a public organization with a board. The way Cover California is financed is via fees on the health plans that participate in it. The way the ACA was set up is that states had an option. They could either start their own exchanges or marketplaces. They could start their own exchanges but get some help from the federal government, kind of like training wheels. Or they could have the federal government come in and operate their own marketplace. We here in California decided we're going to do it all ourselves. And we started our own marketplace or exchange. The principles behind Cover California and the rest of the exchanges include transparency, competition, price, and quality. It's basically ensuring that people have clear access to some of the best plans around at really good prices. Cover California is what we call an active purchaser. That basically means that they have directly negotiated some really good rates. There's some really good features of Cover California. It's an online system, which basically means there can be real-time eligibility determinations. How this is possible is via automated cross-checks with other federal departments. They can verify your income with the IRS, and they can also verify your immigration status. This really makes things quick, it makes them easy, and it limits the amount of paperwork that you may have to do to prove income and that kind of thing. Granted, if there are some discrepancies about your income with the way you reported it versus what the IRS has on file for your taxes, there may need to be some additional paperwork checks and that kind of thing. But many people will be able to get real-time eligibility determinations and get coverage started right away. Cover California actually has two separate exchanges. The main one that we talk about is for individuals and families, for people who want to buy health insurance. There's also another exchange for small employers. It's called SHOP, or the Small Business Health Options Program. So the people who can buy insurance include individuals and their families, and we say individuals, we're talking about citizens and legal permanent residents. And those small employers can also purchase through the SHOP. They can purchase if they have 50 or fewer employees. Individuals purchasing through the individual exchange can qualify for those premium subsidies, again, between 100 and 400% FPL. So quickly, some information about the SHOP. This is for employers with 50 or fewer employees. In a few years, in 2017, that's going to open up to some larger employers, at least employers with up to 100 employees. It could go to 100, more than 100. We'll see what the state decides. There are some tax credits, as Lucian was discussing earlier, for certain small firms that are low-wage firms. The really cool thing about the shop is that it's a joint effort between employer and employee. The employer chooses the level or tier of coverage, and they choose what's called a reference plan. This is a plan they say, we're going to pay for the costs associated with this kind of plan. Then the employees get to go into the shop and choose whichever insurance company, insurance plan that they want in that tier. That's great. So if I want one plan but my other colleague wants a different plan, we both get to have what we would like. It's for employee choice, and this is a big departure from what is common in the small group market right now, where typically there's not a lot of choice. Employees can choose to get a plan that is more expensive but in the same tier as the reference plan, but they are going to be responsible for the difference in cost. Some of the benefits of Cover California plans is that they include all of those 10 essential health benefits mentioned earlier. Every single plan has that, which is fantastic because you know what you're getting. Plans have also been standardized in other ways. Essentially, they have the same copays, deductibles, cost sharing, etc. for each of the metal tiers, but they change within tiers. So that standardization process basically means that you can make apples-to-apples comparisons between all the plans. You know what kind of product you're getting, you know what the benefits are, and you know what the cost sharing is like. So then you get to go and look at the provider networks and other factors and make the best choice for you. There are 4 tiers of health plans: platinum, gold, silver, and bronze. These are metal tiers, and those are the main plans that we're talking about. Each plan has an assigned actuarial value. What this basically means is what percentage of cost is the health plan going to pay for. A platinum plan is about 90%, gold is 80%, silver 70%, bronze 60%. A platinum plan, a gold plan, those premiums are typically going to be more expensive than a silver or bronze plan. But your cost sharing, like your copays, are going to be more affordable with a platinum plan and a gold plan. So it just kind of depends on if you want to pay more upfront on a month-to-month basis or if you want to pay when you actually receive care. There's also another type of plan called a minimum coverage plan or a catastrophic plan. This is only available to a select group of people. It's only available to people up to age 30 or to people who can prove that they're experiencing financial hardship. And that's that same figure Lucian mentioned earlier about if you were going to be exempt from the individual mandate. These minimum coverage plans essentially have a very high deductible. So some people may feel drawn to these if they don't want to pay a lot of premiums, but they're just not going to get the same benefits because they're going to be responsible for a lot of cost sharing. So we have these tiers, and we know that platinum is typically more expensive than the other tiers. And within each tier, there are different prices. So within each tier, we've got an Anthem plan or a Health Net plan and a Kaiser plan, etc. So each of those prices are going to be different. When you choose a plan upon enrollment, that choice is going to stick for 1 year. This is how it is in the private market, in the employer market. It's very standard. So you cannot change tiers or plans until the next annual open enrollment period. This image just describes that trade-off I was talking about in trying to determine whether platinum, gold, silver, bronze works better for you in your situation. If you're interested in paying more on a month-to-month basis so that you know when you receive care that's going to be a little bit cheaper, you may be interested in one of the higher tier plans. But if you want to keep your premium costs low on a month-to-month basis, some of the lower tier silver, bronze plans may appeal more to you. There's also another product called a bridge plan. Basically, these are Medi-Cal managed care plans that are offered through Cover California. Once again, these are only available to a specific group of people. There's 2 groups. First, there's people who were Medi-Cal members, but their income went up. This is a pretty common thing to happen where your income just goes above the threshold. To keep continuity of care, you can keep your plan, which is great if your income still stays below 250% FPL. The other group of people who can choose a bridge plan are parents or other household family members of kids who have Medi-Cal plans. Because kids go up to Medi-Cal up to 250% FPL, but adults only go up to 133, we know that there's going to be some mixed status families in different plans. Well, now all of the family members can be on the same plan if they choose to, up to 250% FPL. That's great because you can keep the same network of providers. You can keep the same providers if you move in and out depending on your income. And the cost of these bridge plans are expected to be low. They must be cheaper than the lowest cost silver plan. So there are 12 plans participating in Cover California. Cover California has divided up the state into 19 different regions. LA is actually 2 different regions. And there are 6 plans that are participating in LA. Anthem Blue Cross, Blue Shield, HealthNet, Kaiser, ObamaCare, and Molina. As you can see, there's a variety of types of plans, including PPO, HMO, and EPO, an exclusive provider organization. And there's also 3 plans participating in the shop here in LA. Blue Shield, HealthNet, and Kaiser. Okay, so let's stop and take a couple more questions. Okay, so we have a couple shop questions. We have one question that says, do businesses have to offer more than one health plan or can they choose just one? Well, as I was discussing about the shop, the great thing is that the employee gets to make the choice about what plan they would like. The business basically chooses what tier, so silver, gold, etc., and then they choose that reference plan saying we're going to pay whatever the cost equivalent to HealthNet is. If you choose a plan that's more expensive than HealthNet, you're going to pay a little bit more, but you can choose whatever plan you like. So that's the really fantastic thing about SHOP, is it offers more options to employees. Okay, we're not having very many more questions, so let's take just a couple minutes and see if there's anything else. Yeah, we're actually going to take a break for about 5 minutes, and then we're going to come back. Okay, we're going to get started back up again. I'm going to take a couple more questions. So there's some more questions about the employer mandate. Since the employer mandate is delayed until 2015, what options do companies with more than 50 employees have? What about the individual employees in those companies and their dependents? So basically, a vast majority of companies with more than 50 employees already offer coverage, particularly to full-time employees. We don't expect that to change because it's the norm, and there's some really great tax incentives that go along with offering coverage. For those people who don't get offered coverage for whatever reason, next year they can go right into the exchange and they can qualify for premium subsidies. There's not going to be any barriers there. So there's going to be plenty of options for people. There's also a lot of questions about the bridge plans. I just want to make these perfectly clear. Those people who are on Medi-Cal and the Medicaid expansion next year will take adults into the program up to 133% FPL. Kids are already in Medi-Cal up to 250%. So there are a lot of families out there between 133 and 250 where the kids are on Medi-Cal, but the parents either don't have coverage or they have some other option because they don't qualify for Medi-Cal. The bridge plans are basically to get everybody on the same plan. That means that the adults over 133 but below 250 can go into the exchange, but they get a Medi-Cal managed care plan that's the same as their kids. So that means everybody's on the same plan, they have the same network of providers, and that just makes things a lot easier for families. This is separate from the Medi-Cal expansion. It's an independent process, an independent offering, but it's going to be a really great advantage to some families. Okay, so with that, I'm going to give it over to Kiwan Yu, who's going to talk all about premium subsidies and the exciting bits of Cover California, including the costs.
Okay, hi. This is really awkward. It's like leaving a really long voicemail message, but we'll power through. So we've talked a lot about what the products are and what kind of things that people will be able to purchase, but now we're going to get into how much they'll cost, both sticker price and how much it'll actually cost to consumers, especially those with middle or lower income. So we mentioned before that individuals and households with incomes between 100 and 400% of FPL will qualify for premium subsidies. It's also been called premium assistance, refundable tax credits, advanced premium tax credits. They all refer to the same thing. And we usually have training materials that accompany these where we have FPL charts that correspond to dollar amounts. But we have a couple lines here that demonstrates that 100%, the federal poverty level is around $11,000 a year for one individual and a little under $25,000 a year for a family of four. So the way these premium subsidies are structured is people with lower incomes will have lower financial responsibility than those with people with higher incomes, because affordability means very different things to different families who have with varying income ranges. In addition to the premium subsidies, which makes the monthly payments more affordable, there is also a cost-sharing subsidy component which helps reduce the costs for families with lower incomes for when they actually visit the doctor in the form of co-pays and co-insurance and things like that. And one important thing to note is that the subsidies, one, you won't have to calculate by yourself. That's going to be calculated for you depending on what your income is. The other is that you will not be receiving a check from the government for you to forward on to your health plan. That transaction is taken care of directly between the Department of Treasury and the insurance plans. You just pay your part of the bill. It's not a rebate. It's none of that. You just pay your portion, and the rest is taken care of automatically. So, I mentioned before that back to the premium subsidies, those are on a sliding scale. So people with incomes under 133% of federal poverty will only have to pay 2% of their income, which you can see is $27 according to this chart. If they choose the second lowest cost silver plan, and that percentage goes up with your income levels, and you can see on the 400% end, you are responsible for up to 9.5% of your income, which translates to $364 a month, and that's for an individual. So, okay, and the way these premium subsidies are calculated is based on your reported income, and this income is actually the same income you report on your taxes. It's all kind of streamlined to ensure that you won't have to calculate income different ways depending on different programs you're applying for or for your subsidies. And there's a calculation at the bottom which can demonstrate this, and you can read at your leisure, but I think the next slide is better at demonstrating how much people will be responsible for paying depending on their income. So these are actual, I believe these are actual costs, or maybe statewide averages, for the cost of a silver plan for a 40-year-old individual in California. So there's three kind of sets of rows, the most affordable, second most, and third most, and the columns across from left to right are the income brackets, and you can see that the blue part, the blue numbers, are what the federal government would pay for the premium subsidies, and the lines between them are the individual's responsibility. So in the case of here, the second most affordable plan, you would pay $57 where the government would pay $236. So you might notice that the blue number does not change whether depending on how much you make. That stays the same. The only thing that changes is if you start making more money, then that number goes down. But your choice of plan will not affect how much the government will contribute, because that difference is your responsibility. So if you choose a cheaper plan, then you get the benefit of the savings. Instead of paying $57, you would pay $35. However, if you choose a pricier plan, then you would have to pay the difference. And in this case, it would be from $57 to $64 a month. All right. So this is an actual example from LA County. And this is, you can find more information about this from the Covered California's website, coveredca.com, and they have a 100-plus page booklet that describes the prices for a variety of ages and in all the 19 different regions in California. And you can see that there's different tiers of plans: bronze, silver, gold, and platinum, and all the participating plans and the prices for that product. The minimum coverage plan is also shown here because that's an option for those under the age of 30. And one important thing to note is that premium subsidies can't be used towards the cost of a minimum coverage plan. Fortunately, the cost of a bronze plan is actually not too much more expensive than some of the plans offered, some of the catastrophic plans covered, and those with low incomes or middle incomes will be eligible for premium subsidies, which can actually make the bronze plan cheaper than a minimum coverage plan. The bold numbers reflect the cheapest option in that tier. So HealthNet PPO has the cheapest minimum coverage plan, ObamaCare has the lowest cost bronze plan, and so on and so forth. The dashes indicate that that there is no offering in that particular tier, and it's because insurance plans were given the flexibility of designing their plans so that it meets the tier requirements. So in this case, HealthNet offers a PPO in the minimum coverage and bronze tier, but offers an HMO product in the rest. Okay, and these are the similar numbers for a 40-year-old, also in LA County. And I'd like to note that these costs are these are the sticker prices without premium subsidies taken into consideration. And these costs are about 30% cheaper than what's available right now in the small group market. So even without subsidies, this is a pretty decent deal. It's a pretty good deal. Let's see. Okay. And these are the prices for a 60-year-old. Generally, this is about the point when we do in-person trainings, we see looks of horror on people's faces because of the prices. But one, I like to remind you that the premium cost for a 60-year-old right now can range anywhere from $600 to $1,000 a month. No lie. So these are actually a good chunk of change cheaper, but if you consider premium subsidies as well, these prices could be dramatically reduced down to 2 digits for some cases. Okay. And this is an example for a family of 4. You can read over it while you're trying to go to sleep at night. And not as much information has been provided on the shop front, but these are some examples of costs in the shop exchange. And the blue column is what's the average cost of small group plans in the market right now. And you can see that the shop plans are about 15% cheaper than what's available right now. And that's without any sort of financial assistance that's available to the smaller employers, smaller low-wage employers. Okay. Cost-sharing subsidies I mentioned before, this is an option that's available for those with incomes between 100 and 250% of federal poverty level, and it helps reduce the costs of care when you actually visit the doctor. The very, very, very important thing to take note of is that it's only available for people who choose silver tier plans. Premium subsidies are available for bronze, silver, gold, and platinum, but the cost sharing is only available for silver plans offered through the exchange. So what does a cost sharing subsidy actually mean? The last column over here, this is what the copay cost would be if you weren't afforded these cost sharing protections. This is just what you would pay out of pocket if you had an income above 250% of federal poverty level. You pay $45 for a primary care visit, $45 for a lab test, etc. With the cost-sharing protections and the cost-sharing subsidies, people with very low incomes would only have to pay $3 for a primary care visit compared to $45. Generic drugs would also be $3. X-rays and diagnosis would be $5. And it does increase with increased incomes in this bracket, but it does provide a good deal of financial protection for very low income individuals and families. We mentioned actuarial value before, where a silver plan was 70% actuarial value and a platinum plan was 90%. For low-income individuals and families who have the benefit of both the premium subsidies and the cost-sharing subsidies, the actuarial value shoots up to 94%, meaning that it's a better value than a platinum level plan. But this is only available for silver plans. Please remember, silver is better than platinum. A lot of times when people hear about this by now, they're interested in dropping their employer coverage and jumping into Cover California. In general, though, this is not an option for people who have offers of employer coverage. There is a relatively high financial bar you'd have to clear in order to be eligible to purchase a Cover California plan and receive premium subsidies. The cost of your portion of premiums would have to exceed 9.5% of your household income. And based on the studies we've read and anecdotal evidence, it's a pretty high bar to clear. So the rule of thumb is if you have employer-sponsored insurance, you will probably have to stay with it. You can choose to buy a plan in Cover California, but you have to pay the full sticker price. No premium subsidies. Sorry about that. And reconciliation is the process at the end of the year when you try to figure out whether or not you receive the correct amount of premium subsidies throughout the year. The alternative could have been you pay all your medical and healthcare costs out of pocket and receive a rebate at the end of the year. But like most sane people, rebates suck and no one should ever be subject to it. So this is kind of the alternative that the federal government has planned out, where you try to accurately project your income and you receive the appropriate amount of premium subsidies throughout the year so that you're not either hit with a big bill at the end of the year or you miss out on a lot of the premium subsidies you're eligible for throughout the year. That financial flexibility is very, very important, especially for lower middle income families. So to make sure that you receive the correct amount of premium subsidies and you take full advantage of what's available to you, if there are any changes in income, increase or decrease, it's very, very important for households to update their income, which we've been told can be done online, over the phone, all sorts of different avenues, so that there is no panic at the end of the year. Okay. So at this point, before we jump into enrollment issues, I'm going to take a few questions on Cover California and premium subsidies. Okay. The numbers I quoted are monthly payments. I just want to clarify that. Thank you for asking. So there's a good question. Since the price of health insurance, as you mentioned, 30% lower, will the employers who now offer health insurance be switching over to Cover California options? Employers right now, large employers, will not be eligible to participate in the shop. Some of the smaller employers can choose not to offer their employees coverage and have them access premium subsidies and through Cover California. That is an option. If your employer drops the insurance plan, do you become eligible? I'm assuming this is for a smaller employer or no, it doesn't. Yes, you do become eligible. The ACA says that they're going to be fair and offer low prices for consumers. Why is it that age makes a big difference in price? I mean, the general rule of thumb is that with age, our bodies seem to creak and groan more, so we access more healthcare, so healthcare costs for people who are older costs more.
There's a limit.
But yes, there is a limit, as we mentioned before, of the age ratio, a 3-to-1 age ratio that protects the costs, so that the cost of a monthly premium for the oldest is not greater than 3 times that of the youngest. So a 64-year-old's premiums can't be more than 3 times that of a 19-year-old's. If a small employer currently offers insurance, can they switch to Cover California exchanges to earn the 2-year subsidies? I can't see why not, if that's the case, if they do it during the open enrollment period, which I'm going to get to in a second. If your employer offers insurance for your children but the cost is too high, can the kids go through Cover California? As I mentioned before, there is something called a kid glitch, and it's because that employer responsibility that I mentioned earlier, the 9.5% is a high hurdle to clear. That also includes children, but the way it's calculated, it's the cost of only the employee, not the cost of all the dependents in the family, which makes it a very high bar to clear, even for families that have employer-sponsored coverage. So they will not be able to participate in the exchange unless they're willing to pay full sticker price for Cover California plans. But they may be eligible for Medi-Cal, so that's another avenue you might want to explore. If an individual is at 100% federal poverty, will they qualify for a subsidy? So with the expansion of Medi-Cal, why would a consumer purchase a plan if they qualify for Medi-Cal? That's a good question. For the most part, if you're eligible for Medi-Cal, you have to stay with Medi-Cal. You are not eligible to receive premium subsidies or financial assistance through Cover California. The only exception to that is if you are a new legal permanent resident, which means less than 5 years of residency, and your income is between 100 and 133% of the federal poverty level, and you are a childless adult. It's a lot of ands. Then even though you're eligible for full scope, no cost Medi-Cal, you will actually be put into a Cover California plan with an added financial subsidy from the state to make sure that the costs are very similar to a Medi-Cal program. Some of the other, actually, never mind. Who will determine if an individual will have to pay back or receive a check? This is all done during tax time. So when you fill out your taxes at the end of the year, there's going to be an added section where it calculates how much premium assistance you receive throughout the year and what your actual income is, and based on that calculation, the sliding scale cap I mentioned before, the difference has to be reconciled. So if the government owes you money, you'll get that as part of your refund. If you owe some of your premium subsidies back because you earned a little bit more than you thought, then that could be deducted from your refund. If a person is fired and is left without insurance, will they be able to buy insurance to cover California anytime or only during open enrollment? Okay, so this question actually jumps the gun a teeny tiny bit, but if you are fired or if you lose your job somehow, then you will be eligible to purchase insurance to cover California outside of the open enrollment, but you have to do so within 60 days of you losing your job. And if you miss that window, then open enrollment is closed again for you. You have to wait until the next open enrollment the following year, or at the end of that year. Okay, so those are the questions for Cover California for now. I'm going to quickly go through some enrollment issues and then take questions at the end of that. So if you have any questions, submit them and we'll get to them at the end of that section. Okay, as we've mentioned before, open enrollment this year is starting in, what is it, 10 days, 9 days now? It's a little terrifying to think about. It's October 1st of this year and it extends through the end of March of next year. It's a special extra long 6-month period because Cover California is a new expansion, new kind of project going on, so we want to make sure that people learn about it and enroll and no one's left out. But for following years, it's only going to be a 3-month enrollment period. So people can only buy insurance during this period, otherwise they'll have to wait until the next open enrollment. And the way this works is if you successfully apply, so your eligibility is determined, you are A-okay to go, in the first half of the month, your coverage will start the first of the next month. So if you get everything squared away on December 10th, your coverage will start January 1st. But if it takes a little bit longer or you wait a little bit and you get all your stuff done by December 23rd, then your coverage will start February 1st. So the takeaway point is, don't procrastinate. Do it now so that your coverage can start as soon as you're eligible for it. Okay. As we alluded to earlier in one of the questions, there are exceptions to open enrollment, and they're generally situations that cause a change in your in your insurance status. So a job change, job loss, even getting a job, marriage, divorce, a death in the family, or other events of that nature. Those will open open enrollment back up to you. That's a very cumbersome sentence. But the important thing, as I mentioned a few seconds ago, is that you have to enroll within the 60 days of this life event occurring. And after that 60-day period, open enrollment is no longer open. You have to wait again. So an added benefit of the ACA is that we've actually gone ahead and made our own, we try to simplify the application process by creating a pretty simplified application. They showed an example of it during the Cover California board meeting yesterday, and this one application can be used for both Medi-Cal and Cover California applications. So this is particularly beneficial to families or individuals who aren't sure what they're eligible for. So they can start filling out the application, and the income is calculated the same way, so you don't have to calculate for different programs, and it's all streamlined, so you'll be routed to the program you're eligible for. So modified adjusted gross income is the standard used to calculate taxes, so that should hopefully save a step and prevent some headaches. Additionally, there will be electronic cross-checks with the IRS and the Department of Homeland Security to verify your income information and your citizenship and immigration status. And I know this puts a lot of fear into many people's hearts when we talk about this. For people that want to avoid this electronic cross-check, there is still an avenue in which you can apply in person or by paper. And applications can be filed in all sorts of ways, including online, in person, via mail, telephone, and by fax too, I believe, if you so insist on applying that way. So, okay. I just want to mention that the next open enrollment is the end of 2014, so October 1st through the end of December. Okay, so Cover California has actually issued a decent number of outreach and education grants throughout the state and a large focus in Southern California to get the word out about these coverage expansions and provisions and all the premium subsidies. So for anyone that's interested in collaborating, these are some organizations that you could look into to help co-brand or complement each other's work. Okay. So before I hand it back over to Carolina, I'll answer some questions on enrollment. Okay. When can we view the Covered California application? A pretty close to final draft is available on the Covered California's policy-oriented website, which is hbex.ca.gov. And if you go into the board meetings tab and you go into the meeting materials for the most recent meeting, which is yesterday, then you can actually download a copy of the PDF. This application is going to be offered in 12 or 13 different languages on paper, and it's available online in English and Spanish, I believe. Also, a few other things that I want to mention is that for people who don't, the unbanked is how we're referring to them, people who don't have credit cards or have checking or banking accounts to pay. Covered California is exploring options for people to pay in cash or by money order, and they're kind of hammering out deals where they can have these be a no-cost option to families who want to pay in cash instead of paying by credit card or through a banking institution. Okay. Okay, we're getting some questions about how an undocumented person could apply for Covered California. So, one, the undocumented are ineligible for any Covered California plans, even if they don't receive any premium assistance or any sort of cost-sharing subsidies. But it is still an option for mixed-status families where an undocumented parent wants to apply for their child. And in that case, you can apply by paper if that's the route you choose to, but you can apply online. And the only Social Security number that needs to be provided is that of the child, not the parent. Covered California was very mindful of the unique variety of families that we have in California, and we didn't want to bias against mixed-status families. Let's see. So there are some options for undocumented immigrants. It's pretty much the programs and safety net options that they rely on right now will remain, and those are emergency Medi-Cal and for pregnancy only coverage as well. The safety net clinics, Healthy Way LA Unmatched will remain, and a lot of the smaller programs such as AIM, which is for Access for Infants and Mothers, Family Pact, which is for family planning services, those, to the best of our knowledge, will still remain and provide care to the undocumented. I think that's it. Okay, and now I'm going to hand it back to Carolina to close us out.
Okay, so right here we have a really interesting chart that we've made that we describe as our Lego blocks. This is a picture of what kind of programs based on income are available to people starting next year. Most of these programs, with the exception of Covered California and Medi-Cal for some groups, are already available right now. Kiwan alluded to some of these programs, like Family Pack, which provides family planning services, and AIM, Healthy Way LA Unmatched. There's also what we call JHPP and CCS for kids and adults with certain chronic health conditions, as well as Healthy Kids, which is one option for undocumented people. However, this is only for children up to age 6. This includes undocumented people and goes all the way up to 400% FPL, but again, only up to age 6. So starting next year, we're going to have this interesting look at healthcare. Everyone, legal permanent residents and U.S. citizens, will be eligible for Medi-Cal up to 133% FPL. Kids will be eligible up to 250, they already are, as the same as pregnant women up to 200. The new addition is Covered California. Anybody who has valid documentation status can enroll in Covered California. The people who will get premium subsidies are between 100 and 400% FPL, and these folks don't have an offer of coverage through their employer. This is a little fun cheat sheet that we like to use, basically because sometimes people get confused about Medi-Cal and Cover California and the specifics of the programs. We also have the bridge plans mentioned in here because they're kind of like the baby between the two. They're a fusion of the two programs. So once again, Medi-Cal goes up to 133% FPL for everyone, 250 for kids, 200 for pregnant women, while anybody can get Cover California, but only that special 100 to 400 group can get premium subsidies. Bridge plans are for the group that's above Medi-Cal eligibility, but still on the lower end of Cover California eligibility, from 133 to 250% FPL. Immigration status for Medi-Cal and Cover California is fairly similar in that all U.S. citizens and legal permanent residents can participate. There's no waiting period. The only weird kind of exception is that these LPRs, legal permanent residents, who have only been in the U.S. for less than 5 years, they are adults without children living in the home, and they are between 100 and 133% of FPL. Instead of being in Medi-Cal, they're going to be in Cover California and receive some additional premium assistance from the state. Those undocumented people can qualify for emergency Medi-Cal or for Healthy Way LA. Enrollment is very, very different between Medi-Cal and Cover California. Anyone who qualifies for Medi-Cal can enroll at any point in time, whereas Cover California is subject to open enrollment periods, with the exception for the life events. The same thing goes for the bridge plans. You are subject to open enrollment, or if your income goes up and you lose Medi-Cal eligibility, you have 60 days to enroll at that time in a bridge plan. Medi-Cal does not have any premiums except for the kids who were formerly in healthy families and now have come over to Medi-Cal. While Cover California has premiums, certainly, and they're on a sliding scale depending on your income. And you get premium assistance if you meet those requirements. The bridge plans they do have premiums, but they're expected to be low. They are going to be less than or equal to the cheapest silver plan. Provider network I want to highlight because someone was asking a question about this. Every kind of plan has a different provider network. Medi-Cal often sticks with the safety net but has some private providers, and it is mainly a managed care system. It's not a PPO system. Whereas Cover California, you can choose a PPO that has a lot of different providers, or you could choose an HMO or an EPO that has typically a more limited or assigned network of providers. You could go to the Cover California website right now, and they have some information in their health plans booklet about the size of networks for each plan, about how many hospitals and doctors are included in those plans. Come October 1st, you'll actually be able to go on the site and search for your provider and see what plans are in network for your provider. Bridge plans are going to be limited to Medi-Cal providers and are going to be on a managed care basis. So pretty much identical to the Medi-Cal provider network. Okay, after these trainings towards the end, we like to do some fun scenarios to kind of quiz you guys on what the eligibility rules are and give you some real situations that you may face with your patients or your clients or other people that you know. So this situation involves Adrian, who is a single father with 3 children. All of the family members are uninsured. No one has insurance. So we're going to seek some coverage options for them next year. Adrian is 30 years old, and he makes $34,500 per year. So what programs could Adrian and his children qualify for? So I'm going to give you guys a kind of second to think about this. Remember his income. He makes $34,500 a year. This is a chart of the federal poverty level. Some of you guys may be unaware of what the federal poverty level means and what all these 100, 400, it's really confusing. So this is a chart of what income levels correspond to FPLs. It involves income level and your household size. So Adrian has 3 kids, so his household size is 4. And he makes $34,500. So if we go to 4, and between 133 and 150 FPL is somewhere where he's going to be. So Adrian's household income is equivalent to 146% of the federal poverty level. That means that Adrian is kind of in a funny position where his kids qualify for Medi-Cal, but Adrian qualifies for Cover California. He's not eligible for Medi-Cal. If he was under 133%, he would be. But he is eligible for Cover California and for premium subsidies. In fact, he could also be eligible for cost-sharing subsidies because he's under 250%. And he could choose a bridge plan if he likes, so he could be in the same plan as his kids. We have an estimate of what his premiums might look like. If he chose the second cheapest plan, it might be about $109. That's an average. It depends on where Adrian lives. And he could get a plan that's cheaper than that if he chose bronze or the lowest cost silver, or a bridge plan as well. Okay, let's do one more scenario, and then we'll take a lot more questions. So scenario 2, David and Amber are married, and they have one child. David makes $39,000 each year, and he already receives affordable health insurance through his employer. Amber works part-time, and she makes $15,000 per year. Both Amber and her child are uninsured. So the question is, will the entire family be eligible to receive premium subsidies through Cover California? So we like to do a little true or false. So the first one, true or false, David can get subsidies through Cover California. The answer is false because he already has insurance through his employer. Now, if this insurance was very, very expensive in that it was more than 9.5% of their household income, then he could go and get subsidies at Cover California. However, this is a pretty high bar, and not many people are going to be able to meet that bar. So he's going to generally stick with his employer coverage. Second question, can Amber and their child qualify for Medi-Cal? And the answer is no, because their household income, if you go back and look at the charts, and you could just Google federal poverty level, and you could see all these different income brackets, that kind of thing. Their income is over 250. If it was less than 250%, then the child could qualify. Amber wouldn't unless it was under 133. Now, do Amber and the child qualify for Cover California? Answer is yes, they do, because, well, they don't have employer-sponsored coverage, it sounds like, and so they should be able to get premium subsidies. Now, the twist here is if David's job offers dependent coverage, then likely they're not going to be able to get Cover California subsidies. Because remember, Key1 mentioned the affordability threshold is measured on the cost of employee-only coverage, not family coverage. And finally, do we only use Amber's income when determining her eligibility? And no, we're talking about household income when we're trying to assess eligibility for Medi-Cal or for Cover California. So if you're married, you're counting your income together, you're in one household. Okay, with that, let's take some more questions and we'll wrap up. Okay, I see a great question. Are the dental plans for children in Cover California mandatory, or are they separate? Are they separate plans, or are the costs combined? This is a really good question, and it's been subject to a lot of debate around the exchange. Next year, there are going to be pediatric dental plans available. However, they are going to be separate, independent plans. They aren't going to be what we call embedded in the normal medical insurance plan. Embedding them is a little bit difficult to do, and frankly, the health plans weren't prepared to do this year. Cover California is hoping to offer some embedded plans starting in 2015. They're trying to work with the health plans to see if that's going to be an option, but it's just not going to be ready this year. So basically, when you're applying for your kids, you're going to have some dental plans that you can participate in, but they're going to be separate plans. You're not going to get any premium subsidies for those. That's just going to be applied to your regular medical plan. And but the good news is they're very low cost. We've seen the costs. They're all on the Cover California website. You can go look. It's like dental pediatric plans. They're as low as $8 a month. They're very, very affordable. And, you know, they're not subject to the deductibles that you would get with a silver plan, et cetera, in your normal medical thorough insurance plan. Oh, we have an excellent question about domestic partners as well. So what's going to happen for people who are in a domestic partnership? Can they apply together? Also, what happens if they have children, whether adopted or biological, and how does this affect them when applying for coverage? This is something we've been trying to figure out, and there's still a little bit of uncertainty around this. The tricky thing is that Cover California usually goes off of tax filing status when you're trying to determine who applies for coverage. So if you apply as one tax filing unit for your household, that's who you're all going to apply for at the same time. The tricky thing is that domestic partners are not considered married and cannot file together on a federal level. They can, however, file on the state level. As we understand it, we think that domestic partners will be able to apply together. We don't know if their premium assistance will be determined separately. This is still something that is being figured out. The point is everybody should be able to get coverage. They should be able to get coverage together and get on the same plan. How the bills are going to be assessed, we're still trying to work out. So stay in touch for that one. On a similar note, there's a question about people who are in same-sex marriages. And our understanding is if you are legally married, you are legally married and can apply together. That's your household. There is a question about are all hospitals, clinics, urgent care centers, etc. required to take Healthy Way LA, Medi-Cal, Cover California, etc.? The answer is definitely no. We talked about this earlier in that chart about provider networks. Every single plan, whether it be Medi-Cal, Healthy Way LA, a private plan, an employer plan, a Cover California plan, has their own network. They choose which providers they want to contract for outpatient care, for inpatient care, anything like that. That's up to the individual plans. So if you have any kind of insurance, you can't just assume you can go to any provider. We recommend that you check with whoever your insurance company is. And come October 1st, you'll be able to search on the Cover California website to see what providers are in which plans. Okay, let's see what other questions are out there. Okay, we're not seeing a lot of other questions. So with that, I'm going to give you one last chance to get in some questions while we finish up right here. I want to mention that we are doing a lot of in-person trainings. We like to engage with the crowd in person. We like to have really particular questions and have dialogues with all of you about your work and who you encounter and how this may affect your patients and those you work with. So we really encourage you to attend some of those. Those are all on our website, which is right on the slide right there, itep.org. If you go to the ObamaCare 101 section, right on the homepage, it has a list of all of our trainings. Feel free to register for those. I believe we have one in Redondo Beach next week and another one in the metro area coming up next month. I see another question about information about dental and vision plans. Just to clarify, dental and vision plans are not provided as one of the essential health benefits for adults. They are only essential health benefits for children. So as we understand it, as I mentioned earlier, the dental plans for kids right now are going to be supplemental plans while vision is embedded. There are going to be some options for adults. Cover California hopes to offer supplemental dental plans for adults. They're not going to be available right away, but they should be available next year. As far as vision plans go, those in the short term are likely not going to be offered directly through Cover California. It is quite possible that once you go through your Cover California application, there will be some resources at the end that tells you where you can go to get information on vision coverage and what companies offer vision coverage. But in the short term, at least, they're not going to be offered directly from Cover California. So for those of you who might be interested in enrolling people and becoming in-person assisters, this process was discussed last week at the Medi-Cal training, the webinar that we did. But if you call up Cover California right now, which is just on their website, or you send them an email, they can give you the information on how to become an in-person assister to actually help people enroll. And that could be really great. We need as many people out there on the ground enrolling people, so we really encourage you to do that. They can tell you how to get certified, and they conduct all the trainings for that. So you will have to undergo a background check, fingerprints, and you have to be affiliated with a certified enrollment entity, an organization that has been approved and licensed through Cover California. And once you are affiliated with that entity, you get approved by them, you get your training, then you're all good to go, and you can actually go out there and enroll people. So we really encourage anyone who is interested in doing that to please go ahead and do so, and to do so immediately so we can get people enrolled starting October 1st.
Answer that one.
Okay, so we have a question that says, will undocumented individuals receiving Medi-Cal via PRU-Call, will they lose benefits? This is a great question. So generally people who are living under PRU-Call, permanent residents under the color of law, oh yeah, I got that. If they're residing under PRU-Call, then they're going to qualify for any federal benefits that they may qualify under normal income guidelines and that kind of thing. So to our knowledge, anybody who is currently receiving Medi-Cal via PRU-Call will not lose their benefits. Everything's going to stay the same right there. If you are under PRU-Call and you meet Cover California income guidelines, you will absolutely be eligible for that as well. Any particular questions about certain visa types, etc., that may be eligible for Cover California, please go check out the paper application that's available on their website. They have a whole list of every immigration status that is eligible to participate in Cover California. The undocumented can't participate, but generally people who are legal permanent residents or legal temporary residents can participate, which is fantastic. That's a really interesting question. What happens to people who are transgender, as in what do they fill out on their forms, etc.? This was something that has been brought up to Cover California. From the paper application, it asks if the person is male or female. We are going to get some clarification, we hope, about what answers transgender people should apply to this question. At the end of that application is a very nice FAQ section that has specific questions about, what do I do if I don't file for taxes and that kind of thing. And it has been requested by the community that question, as in if I'm transgendered, how do I answer a male or female question, be added to the end. But as far as a very straightforward answer right now, that is not, we don't have that at this moment. So I'm getting some questions about where can people go to get help with the enrollment process. This is a great question. Unfortunately, we don't have a concrete list of certified enrollment entities right now. We are told that this will be available very, very soon. But if you call Cover California right now, you can get all the locations of where these enrollment entities are. You can get connected to somebody who is in your area. People can absolutely go to the county service centers, the county social services entities, and they are all certified to help you get set up. I also really want to highlight the Cover California service centers. They have call centers, 3 call centers. They're fantastic. They have hundreds of people working there. They are taking calls right now, so you can give them a call. It's on their website. It's very, very clear. It's also available in all of the Medi-Cal languages. There are some direct phone numbers for very specific languages like Spanish and Vietnamese and more common languages in California, and those direct numbers are on the application form. If you are looking for a place to send people directly, specifically if a patient, someone you know, knows that they want some enrollment help, they can go on the Cover California website right now and say, I would like enrollment help, and someone will contact them after October 1st. Or basically you can just direct them to the website and come October 1st when those entities are fully clear and available and out in the open, and then they can go directly to them at that time. Another great question is about people who are on Medi-Cal right now but have a share of costs. They might be in the medically needy program. So these folks are actually going to benefit a lot. If you are on Medi-Cal but have a share of costs right now and you are under 133% FPL, then next year you will have no share of costs and you will have full scope Medi-Cal. That's really fantastic. For those who are still over that 133 threshold, they're still going to be subject to a share of costs. Okay, so thank you so much for your questions. I'm going to hand it over to Lucian right now to wrap us up and give us some words of wisdom.
No words of wisdom, but I've been working on this for 40 years, and so the opportunity to cover the uninsured here under the Affordable Care Act, also known as ObamaCare, is thanks enough that I can celebrate that with my birthday and everything else. So I would just say to you that this has been recorded. We'll have the recordings available on either the ITUP or the LA Care website if you missed a portion of it or want to go back and clarify a portion of it. We had some technical difficulties last week with the Medi-Cal webinar, and we're going to re-record that so that that too will be available. We really appreciate all of you being with us today and asking these terrific questions and helping to spread the word throughout all the communities you work with so that people can take advantage of this opportunity to get healthcare coverage. Many people have waited for many, many years for this opportunity. We really want to thank from the bottom of our hearts the California Community Foundation, which started us down the road to do this. Our partners at the Community Clinic Association have been really essential in doing all the planning and helping us with all the sites, and we'll be doing more in-person trainings with them. For LA Care, who's hosted us so graciously today and been so supportive in terms of funding all of this activity, it's been a wonderful partnership with everybody. If you have additional questions you didn't get asked or answered today, we do have some frequently asked questions that are available on our website. They are constantly updated. You can shoot a email over to trainme@itup.org to get additional questions answered. And my birthday is past, but thank you so much. All right, so I think we are adjourning. Thank you, Roland. Thank you, LA Care.